Now, I mean, overall, you can imagine that they are all licensed or have the appropriate certification, if you may. But overall, is assisted living regulated, and how is it staffed, or what should we be considering?
Certainly,
So-
certainly. So you have, with assisted living, you have, assisted living is licensed through the Department of Healthcare Quality. That's the organization that licenses and also surveys assisted living communities. And under that umbrella of the Department of Healthcare Quality, assisted livings go through an accreditation process in order to be able to be licensed. A registered nurse, or also known as a delegating nurse, I kind of refer to it as their license is kind of like the roof of that community. The care is administered under the license of that registered nurse, and it can be administered by other types of credentialed individuals. Different from a skilled nursing facility, also known as a nursing home or a health center, where a medical director, an MD license, is over top of that community or facility, and the care is kind of administered under the license of that medical director or that medical doctor to the individuals that live in that community. So that's a differentiator. In assisted living, you also, in addition to the certified nursing assistants or licensed practical nurses that may work there, they also must have a med tech on site 24/7 who's able to administer medications, and that's a little bit different from a private duty caregiver that might be coming into your home. And so that is an important distinction between those kind of two different scenarios. And so a med tech must, in addition to that CNA or other professional, must be the one that's actually passing the medications and administering the medications and documenting that. And so when the state comes in to survey or to check, they're really looking at the records of that assisted living, and they're looking at the documentation of that med tech's documentation of how those meds have been administered and provided to that resident. So that's usually a service that most assisted livings, most residents in assisted living will have their medications administered through that community. It's not necessary, but most do, because it's just a little bit of a safer monitoring system. But if you as an individual are able to administer your own medications, and you're able to work with the registered nurse there to show that you understand your medications, and that they would be held separately in a locked medication box, but then they would bring them to you, and providing that you're able to safely administer, and you know the side effects and all your medications and things like that. You can live in an assisted living and still administer your own medications, but it's done, I would say, more rarely than the norm.
Okay. And these medications is really super critical, if you may.
Yeah.
Because it's either you miss them or you're taking so much more that you need.
Yes.
And then the other factor too is that what we all need to go ahead and consider is that whatever your prescription is for this year or 6 months, we need to go ahead and make sure, check it again after whatever that duration is.
Yes.
Because if you don't need to take it, then why take it? And
Yes.
those type of things.
Yes.
So, and then at the same time, as you mentioned about the contraindications of HMA, the side effects, I mean, obviously that's where their expertise will go ahead and come in. But you as the individual or the caregivers of such loved ones, you go ahead and pay attention to such things to go ahead and make sure that all of those things are accounted for and they're absolutely needed.
Yes, absolutely.
So,
And that's one of the things, every 45 days under assisted living statutes, the delegating nurse does come in and do a care assessment or a review of your care plan. And that's, at that time, sometimes medications are changed, in conjunction with the physician and things like that. But that's just another safety that's built into that model of assisted living to make sure. And then I believe it's every 90 days, there's a pharmacy check, where a pharmacy that is the pharmacy that's associated with the community sends a pharmacist in to review the residents' pharmacological medications to make sure that that everything is kind of matching up.
Super critical. I can't emphasize it anymore. So again, all of those, you do have to go ahead and consider that those are being taken care of and that somebody's doing it. And again, somebody registered and or licensed
Yes.
to go ahead and to monitor such things. And so I know we've already talked about different types of payment and in terms of the possible insurance that you guys may have to cover such costs. But and I know you kind of briefly touched base with this, but is there anything else that you want to talk about in terms of the overall cost that these families need to consider? I mean, obviously, if they're super well off, then obviously that's fine, I can imagine. But if they have limited income or if there's any government assistance, if there's anything else you want to add in that regard?
I would say just to put some perspective around the different numbers, if you're looking at assisted living care, you're looking at the average cost in the state of Maryland is about $4,500 a month. And that covers 24-hour care, oversight, 3 meals a day, hydration, snacks, things like that. You'll find a range starting at about $2,200 up to about $12,000, but I'm giving you a medium and average, so to speak. And the average cost of nursing home level of care is going to be about $14,000 a month if you're paying privately for nursing home level of care. However, for many individuals who have low income but need nursing home level of care, they and their families will apply for Medicaid. And Medicaid is a state and a federally funded program that pays for care in skilled nursing. And so if your loved one meets those criteria and the requirements for Medicaid, then their care is predominantly going to be provided in a skilled nursing facility, which is a little different from the way that Medicaid used to be provided up through 2017. There were some major changes that took place in Medicaid law in this area. And so these are all considerations. The average cost of private duty care, if you were to bring in a private duty caregiver into your home, is about $280 a day. If you were to, it's about $25 an hour average. And so when looking at the different options, it's important to kind of just have a framework of reference as to how you connect into those programs and what they are.
Thank you. And obviously that's a major decision maker, if you may, how to make a decision.
Yes, yes.
In terms of what's available out there. And
that's why you want to pull in like multiple resources, like,
yes.
like our service and your professionals at AAA Physical Therapy, because collectively and collaboratively we work as a team,
yes.
And we're constantly learning and refreshing our information from working with such great partners, and we really as an organization want to collaboratively help support you, and so I would encourage you to know that there are helpful resources out there, and that we're really want to step up and help out.
And with that, I think that's a great segue. And no, we didn't script it. We didn't script that, but that's one of the reasons why we're doing these beanbag banter programs, is because we don't know everything. And us being an outpatient physical therapy practice, people come in there that very much, for the most part, they're rather independent.
Yes.
But at the same time, however we can inject, because again, aging is going to happen. They need to start planning and thinking about, what if I can't come here anymore?
Yes.
And what do we do? And And then feel free to share, to talk about this a little bit more if it's okay with you, is that, for example, for us, sometimes we go to assisted living facilities to take care of Medicare Part B, wherein we focus on prevention, and again, whatever activities of daily living that they can continue to do, that's what we try to go ahead and target. And maybe that's something that either the ALF owners and or the residents there would consider. But would you like to talk a little bit more about that, or?
Help me
Yeah.
frame that a little bit for me.
Okay, so for example, with some of the ALFs that we have been working with, we come in there as an outpatient PT practice, as a home visit, and we use Medicare Part B. So we already know what Medicare Part A does, but after that, that's where we go ahead and come in, because what we don't want is they relapse because they don't continue with their exercises or stretches, or just basically whatever movement that they can continue to do. And then if we add in other ingredients into the picture, whether if somebody's suffering from Parkinson's or Alzheimer's, then again, having these guided exercises or movement provided by the therapist, that would help them. And again, and I think from an ALF point of view as well, that's critical for them because they don't want their residents to be admitted.
Right.
Right?
Yes.
Because that kind of counts against them, or
Yes.
something to that effect. And so overall, prevention is the key. The reason why we're doing these beanbag banter programs is because, again, to provide you the necessary information so that you can go ahead and start thinking about such things and try to research on your own wherever you are in that situation. And again, with us as a PT practice, we really focus on prevention, because if you fall and you hurt your hips, and then now all of a sudden you're hurt, your ADL, or activities of daily living, is now impacted tremendously, then now your health goes downhill fast.
Yes, yes.
So again, nobody wants these things to happen, but these things do happen. Aging is definitely going to happen. So we have to start considering all of these things, and then again, what are we doing in our day-to-day lives to go ahead and either prevent it or be as healthy as possible and have the best quality of life that we can have, regardless of what age we're in. And so, and if you're already assigned at an ALF, or you're going to be assigned into an ALF working with Bonnie, so those are things that you guys could go ahead and consider as well, in terms of how how such facilities are engaging all of these other
resources
to
help their patients.
Yes, and or professionals, just to go ahead and make sure that you're not just sitting down and watching TV all day and stuff like that. So now, if indeed that's the only thing that you can do, then it is what it is. But however we can continue to be active, whether in ALF or 5-year-old or what have you, we continue to be active. So, and then you mentioned earlier about the proper nutrition. So yes, all of these things we take into account. And hopefully we'll have a guest that will talk a little bit more about nutrition as well. And so again, thank you for watching this. But before we wrap things up, I mean, I know we kind of have this backdrop here. Care to share a little bit more, at least with this thing, what it is?
So what
And
you're
then
seeing in the
maybe
background here is,
yes, we can bring it a
some
little bit
different
closer.
awards.
Yes.
Within our organization, we have different things that we focus on, different metrics that we look at, and different things that we focus on. And these are some of the awards that my franchise has earned based on our service, and what we're known as is a wonderful team player. We mentor other franchises within Care Patrol and within the organization overall, and we work very hard collectively with them to try and help them get up to speed and to make sure that they're making the right connections within their communities. And so this is the Top Region Award for collaboration.
Wonderful.
And then this is an award that we won this year in 2019 for being a top 40 across the country in client satisfaction and in the 5-star areas that they look for us to excel.
Wonderful. And again, that's why we brought it here, so that if you're looking for one, feel free to go ahead and consider Ms. Bonnie Danker, Care Patrol, and these are the things that they've won or received.
Yes.
And that's what we try to go ahead and do, to go ahead and collaborate with really great people out there, and that they're doing what they're supposed to be doing, and providing information. That's why, again, I mean, I'm not surprised, because she's here. She did this program with us, and again, we're super thankful for that. So on that note, anything else that you want to go ahead and share about Care Patrol or overall care with advanced age group, if you may?
Just it's changing all the time. You know, we are in the fast lane, and so I encourage you to really reach out and allow the professionals in your area to serve you.
Okay, wonderful, no doubt. Thank you. All right, Ms. Bonnie, thanks
Thank
again.
you so much.
All right, so we'll see you again for the next Beanbag Banter program, and thank you for tuning in. And feel free to share this to all of your loved ones, because everybody's aging, whether you like it or not. It's going to happen. Let's just all face it, accept it, and if we accept it, then we will be able to manage things a little bit better. All right? Thank you again.